Good evening, everyone. So today we are going to have a very important topic, which is demystifying pet allergies, and for which we have a very important person today with us, Dr. Shambhu Samazdar. So Dr. Shambhu is a very renowned allergist of the country, and currently he is practicing in Calcutta, and he has done a lot of work on allergies, and especially he has got a special interest about pet allergies. So we are very fortunate that Dr. Shambhu is with us to share his experience and to moderate this session. Welcome, Dr. Shambhu. We can start the session.
Thank you very much, sir. So, good evening, everyone. It is a pleasure to welcome you all to today's insightful webinar, Demystifying Pet Allergies, brought to you by the Indian Academy of Pediatrics, Allergy and Applied Immunology chapter. In a world where pets have become cherished member of our families, the rise in allergic responses to dogs and cats is growing clinical concern. Recent studies show that nearly 27% of adults evaluated for inhalant allergies in Europe are sensitized to dogs and 26% to cats, making them one of the top 3 sources of allergic asthma, trailing only mites and pollens. So this session aims to unravel the complexities of pet-related allergies from diagnosis to cross-reactivity, from exposure risk to immunotherapy options, and how an allergy expert can guide families through evidence-based approach while balancing the emotional bond between children and their pets. We are really honored to be joined by 2 renowned experts in the field, Dr. Anil Sachdev and Dr. Neeraj Gupta, who bring deep clinical and academic insight into the science and management of pet allergies. I look forward to an interactive and enriching discussion that empowers us to deliver a better care. Let's begin. To kick off today's session, we are really privileged to have with us one of the most respected figures in the field of allergy and immunology, Dr. Neeraj Gupta, senior consultant at Sir Gangaram Hospital, New Delhi, who needs no introduction at all. He is a pioneer and thought leader. Dr. Gupta has been instrumental in shaping allergy care in India through his clinical expertise and academic contributions. Today, he will share his insights on pet allergies with a focus on dog and cat allergies, conditions that are not only medically complex, but often emotionally challenging for families. From clinical presentation to diagnostic nuances and management strategies, his talk will promise to offer a valuable guidance for both practicing clinicians and students. So, Dr. Gupta, this virtual floor is yours.
Thank you. Thank you, Dr. Shambhu, for the very nice introduction of the topic. And let us try and understand about the spectrum of pet allergies, diagnosis, and beyond. So first of all, I would like to describe that what is commonly called as pet. So pet is somebody or some animal or bird that we usually keep in our home for the activity of pleasure rather than for food or for work. So the commonly used pets or the commonly kept pets are dogs and cats, but now there are different type of you can say like taste and different type of likings of the people across the globe, and people sometimes keep fish, sometimes they rear some birds like parrots and sometimes pigeons, sometimes they rear some rabbits, and even across the world people have, you can say like have some different habits. You might be surprised to know that there are certain people who actually rear some rodents and reptiles. So once again, I would like to reiterate that pet is some animal or bird that somebody is keeping for the activity of pleasure only rather than for food or work. So for an example, if somebody who is keeping goat or somebody who is keeping sheep or somebody who is keeping cow or buffalo, So they are not coming in the category of pets. Pets is only mainly because that they are giving you some pleasure or some good activities. What is the percentage of people who are living with pets? So as per the estimate, obviously this is like a global estimate and not a current Indian estimate, but majority, maximum pets which are counted by dogs, and then these are very closely followed by cat. And the scenario is going to change soon because now the people are trying to get more and more cats in, and there will be time sooner that in which this cat number will also increase along with the dog number. Then I just mentioned that this is also followed by some fishes and then birds and others. And as per the study, the 43% of the people were also found to be having no pets. So this study seems to be a little surprising and alarming that nearly more than half of the population of the study subject were actually having one or other type of pet. Obviously, this is not the study from India. This is basically based in United States, but definitely this is something which is telling us that yes, pets are so important, so essential in human life, and they are, you can say, like coming together. So increase in the pet ownership is actually happening. And what is happening, like initially there were joint families and then they become nuclear families, and now majority of the time even nuclear families are now broken and they are now going to the single person. So there is a rise in the single person household, and then who is coming as a companion? It is a pet who is coming as a companion inside. So the disease burden, the disease means that dog or cat allergy or the pet allergy, I would like to say, that has been estimated nearly 10 to 20% of the global population, which is a hugely alarming number. Even in Korea alone, nearly 16% of the inhabitants are sensitized to dogs. In Sri Lanka, 1.2% are sensitized to cats and nearly 9% are sensitized to dogs. And then in certain districts of China, even nearly one third of the people are sensitized to cat hair and equally to the dog hair. So healthcare cost is also relatively increased because of pet allergy. As per an estimate, it has been seen that there are increased number of visits for acute asthma care among dog allergic adults who choose to live with dogs. Additional burden of nearly 1 billion US dollar in 2010 alone has been added just because of those visits in which the owner were having these cats or the dogs or these pets, and they were actually sensitized to them, but they were not willing to, you can say, like remove them from the home. And the risk factor for new onset reactive airway disease, if somebody is having any type of pet, then the relative risk is considered to be 1.6, and if there is a dog, then at that time the relative risk is considered to be 1.4, which is, you can say, like definitely an increased risk. What are the problems in the diagnosis? So the problems in the diagnosis are that dog and cat allergen exposure is considered to be, you can say, like uh, ubiquitous. You cannot really escape this exposure. Dog allergens are less defined. I will be coming in detail about that. But dog allergens are considered to be less defined. There is a correlation between serum Ig, means like I'm talking about specific serum Ig, to dog and the skin testing is poor with only 50% agreement and correlation coefficient of 0.04. And the contamination of crude dog allergen for skin prick test with others like dust mite might also give false positivity. What it means that suppose if you are testing someone for the dog allergen, either by the skin prick or probably by the specific Ig, then neither the positive value nor the negative value is actually helping us in either diagnosis or ruling out dog allergy in a subject. And ultimately, it is not very much helpful in, you can say, like medical management of that particular child or an adult. So let's discuss one by one. As Dr. Shambhu mentioned, that I will be predominantly focusing on the cat allergens or cat allergies and dog allergies. So let me first discuss with the cat allergen. So cat allergen, so cat itself is having, you can say, like different components. Cat allergen itself is having different components, among which the FEL-D1. So from where this FEL-D came, so FEL-D is basically Felix domesticus. So cat is means like but scientifically called as Felis domesticus. Now, with this Felis, which is Fel is the genus and domesticus D is the species. So Fel D. Now, depending upon the discovery of the component, the numbers have been given as 1, 2, 3, 4, 5, 6 like that. So Fel D1, Fel D1 is the first allergen of the cat which has been identified, and this was identified nearly 50 years back by Oman. And the most dominant allergenic protein is Fel D1, which is considered to be most allergenic. And among all the cat allergic people, FeLD1 accounts for nearly 96% of all the patients. There is no significant cross-reactivity with other mammalian proteins. Functional role is still questionable in a, you can say like in a healthy cat, and the crude extracts and immunotherapy is easily standardized as based on FeLD1. There is a one peculiar feature about this FeLD1. The peculiar feature is that this FeLD1 itself or the cat allergen itself is considered to be, you can say like universal. It's a universal allergen. So what I want to say that FeLD1 is one allergen which is the predominant allergic protein of cat family. That means the entire cat family, if somebody who is allergic to one particular cat, then it is considered that all different type of cats and the different families across the globe. So the person is likely that 95% of the chances, 96% of the chances that this person will be allergic to because they all are sharing FeLD1. And because this is a common allergen which they are sharing, that is why the testing to cat allergies, that could be either the specific IG or the skin prick test, is having a higher value. And simultaneously, even immunotherapy is also having a higher value because it is a common enemy. It is a common allergen. You have to just target your immunotherapy against that common allergen, and then you can actually practically go out of the cat allergies in majority of the situations. Now, FeLD1, which is, you can say like aerosolized. So it is produced by the saliva, by the sebaceous gland. And then it is when aerosolized, then with the larger particles, like more than 9 micron particle, or I will say 10 micron and beyond particle, it is usually associated. But sometimes in 23% of the cases, it can also be associated with PM 2.5 particles or PM 10 particles also. And at that time, it can stay suspended for several days. So this is the table which is actually showing the different micron size of the particle and what is the anatomical location that this particle is going in the human respiratory system. So suppose if a larger particle is there, which is somewhere around more than 10 micron, more than PM10, then at that time it is likely that it should remain in the upper airway of the nostril. Even PM10 particles also remain in the upper airway like the nasal cavity or as maximum as in the pharynx or so. Whereas as you are going from PM10 to PM2.5 or even smaller particles, then at that time you are entering more deeper and deeper. So the message is that majority of the time the cat allergen is carried by the larger particles. That means majority of the symptoms are upper respiratory tract symptoms, could be nose, could be throat, could be pharynx, or could be larynx. As you are moving down, then the chances of, you can say like cat allergen induced symptoms are lesser, but it is not impossible. Yes, it is possible. Cat allergy induced asthma is also there. So it can definitely create lower respiratory tract inflammation and simultaneously symptoms. But majority of the time, 75% of the time, it is likely to create upper respiratory tract problem like rhinitis. Now, from where this FeLD1 is produced? So there are two important sources of FeLD1. So the one important source of FeLD1 is there in the saliva. So in the dried saliva, so what the cat is doing, whenever the cat is masticating food or something, then at that time this saliva is produced. Now this saliva is actually having this major allergen which is called as FeLD1. Now this saliva is getting deposited over the mouth, around the, you can say like in all the fur around the mouth area. So, and the cat is continuously licking its own fur, and ultimately this whole hairy coat of the cat is actually getting deposited by this FeLD1. And then when during, you can say like drying up of this saliva, then this FeLD1 get aerosolized and ultimately gradually it comes into the, you can say like into the aerosolized particles. Simultaneously, FeLD1 is also produced by the sebaceous glands and which is there in the hair coat of the cat. So these are the different components of the cat allergen which are known to us. Basically, 8 components are known to us, FeLD1, 2, 3 up till 8. And these are having different molecular weights. The most common was is the FeLD1 I just mentioned you. It is the most allergenic one. And the main source is saliva. But there are other allergens also which cat is producing like FeLD2, 3 and all others, which are actually found in the dander and the urine and serum and all this thing. And there are different functions which have been described to, you can say like this FeLD1 and all other allergenic proteins in the cat. So the components which are actually important for allergists to us are the first component, which is FeLD1, which is also called as secretoglobulin. So it is predominantly produced by the cat sebaceous gland and salivary gland. And simultaneously, there are other sources like lacrimal gland, anal glands, they all are producing. And this is present on the skin surface and the fur. The important thing is that it is irrespective of the hair length. So whenever we are talking about dog allergies or cat allergies, so the common myth is that if there is a long hair pet, then more allergy or more allergenic. Short hair pet is less allergenic. But this is wrong. the hair length does not have to do anything related to the allergenicity of the pet allergen or the pet dander. It is basically produced by the saliva, by the sebum. So ultimately, it is the dander, and dander is actually equal in all lengths of the hairy pets which is there. And FeLD1 is, I told you that it is nearly 95-96% of the time it is FeLD1. The other clinically relevant allergens from the cat are FeLD4, which is found in nearly 63% of the cat sensitized people, which is predominantly responsible for atopic dermatitis. So FeLD1 is predominantly responsible for the respiratory symptoms and atopic dermatitis. FeLD4 alone is responsible for atopic dermatitis. So you might be surprised. A child is presenting to you in the OPD with atopic dermatitis. On digging deep in the history, there is some temporal relationship with the cat exposure. You test for the cat test comes positive. Remove the cat, after some time the atopic dermatitis also start improving or at least getting controlled. So this is probably with FeLD4, and FeLD4 and FeLD7 cross reacts with FeLD1. And then there is FeLD2, which is considered to be minor allergen with only 15% binding. So I just mentioned that these are the certain, you can say like earlier one are the certain allergens which are important for the cat. And now moving from cat to now the dog allergen. So this is the dog component allergen. These are the different dog component allergen. So dog is nicknamed as CAN-F. So cat we were saying FeLD, and dog is called as CAN-F. Now this CAN-F is like once again different components. So 7 components have been described, 1, 2, 3 up till 7, and with a different molecular weight. And once again they are produced by the saliva and the dander and the sebaceous glands and all other things. And these are mainly having different functions which are mentioned here. Among which the different components, among which the most common one are these 4, CANF1, 2, 4, and 6. And the sensitivity pattern could be nearly 50%, 20%, 30%, 38%, like that. And then others are like CANF3, CANF5, and CANF7 also, which are also possible and there. So currently, 7 dog component allergens have been identified by International Union of Immunological Societies. The major allergen is considered as the allergen with more than 50% of allergic patients need to react to this. None of the dog allergen is considered as reactive as cat. I just mentioned that the cat allergen reactivity, especially the FeLD1, is up to 95%, 96%. What it means that if there are 100 people who are allergic to cat, out of which nearly 95% will have FeLD1 positivity or sensitivity. Whereas in dog, if we just go back to the slide, so in dog, if suppose 100 people who are coming sensitized to the dog, then at that time, nearly 50% or 49% will be to CANF1, then another 1/5 will be or 20% will be to NF2, something like that. So none is basically the major predominant allergen as compared to cat. So that is why cat is considered to be more allergenic, higher allergenic as compared to dog. The other important thing about the dogs is that allergen concentration vary between the breeds and within. What it means is that there is a interspecies variation. So for an example, if somebody who is allergic to one species of the dog, but it is possible that he might not react to the second or the third species. So the second or the third species will behave like a hypoallergenic species to this particular person. But another person who might be reacting to second or third species might not react to the first one. So the first species will act like a hypoallergenic species to this second individual. So what I want to say that the concept of hypoallergenic pet or hypoallergic pet is not existing. It is person to person variation, species to species variation, and within the species, even dog to dog variation, the allergenicity can vary. The other important thing, even in the same dog, as the dog is aging, so the older dogs produce more allergens because their skin becomes more drier and drier. And more skin, that means more allergens are produced, more allergens are shed. So older dogs produce more allergens. And it has also been seen that there is seasonal variation which can also affect the production of dog allergen production. And ultimately, these patients might come up with like perennial symptoms with some seasonal exacerbations of the symptoms. Some breeds are more prone to eczema and seborrhea. So the key factors among dog and cat, if we just want to summarize, so among the dominant allergen in the cats, it is 96% is FeLD1, whereas in dog, actually it is difficult to say that which is dominant, different literature, heterogeneous literature, but the bottom line is the cat allergen is much more allergenic as compared to dog allergen. And then different components have been identified, 8 and 7, which I have just mentioned you. And I just told you that the skin prick test is having more value, or the specific IG is having more value in the cat as compared to dog, with the reason well explained. And simultaneously, for the same reason, immunotherapy, allergen immunotherapy is much more successful with the cat allergen as compared to the dog allergen. And I just mentioned you very clearly that there is no concept of hypoallergenic pet or hypoallergenic animals which is existing. Sometimes what is happening that on different, you can say like markets, or probably for different reasons, the people might sell, or people might claim that, okay, this is hypoallergenic pet. But in practicality, any particular pet could be equally or more allergic to one particular individual, could be less allergic to other particular individual. So there is no concept of hypoallergic individual. Then coming to the cross reactivity. So yes, sometimes it is possible that there are some components of dog or cat, they can also cross react, and sometimes they are also cross reacting with the horse. You might also be means like wondering that who is, you can say like rearing horse. So you might be surprised that yes, horse riding is one thing which is actually common nowadays, at least in schools, at least in secondary schools or senior secondary schools, at least in, you can say like the this private schools and higher state schools, horse riding is equal there. And that is why horse sensitization is also an important phenomena. I myself have seen one child with horse test coming positive or horse dental test coming positive with a significant history, exposure to the horse during horse riding, and the development of the symptoms. Then dog can F3 serum albumin cross reacts with the allergens from the other furry animals. So this is also important that other furry animals also can actually cross react with this dog allergen. That is why I told you that if something which is positive in the dog testing might not be the true positive, something which is negative in the dog testing might not be the true negative. That is why dog allergy testing is somewhere considered to be like more plus minus type of the thing. And then these are the different pet allergenic components for different one, like Bosch D is there for the domestic kettle, which is mainly used for the cow. Then dog, different components are there. Guinea pig is there, donkey, domestic horse, cat. So all these components are actually like lipocalin. So for an example, if somebody who is sensitized to lipocalin, then all these tests can come positive. Dog can have one can come positive. This domestic cattle like cow or buffalo can come positive. Then even guinea pig can come positive. Cat can also come positive. The lipocalin element of LD4 like that. So that is the importance of component result diagnostic, that we actually come to know that which is the cross-reactive allergen which is coming positive and which is the true allergen which is coming positive. Similarly, these are the lipocalin, you can say like amino acid sequences in different species. Like these are the different components of the dog itself, and then these are the cat, and then horse, and then other species like domestic cattle and others. So in which you can just see that what is the you can say like the identical homology of the lipocalin or the serum albumin, and based upon this chart, actually the cross reactivity can happen. So if suppose somebody who is exactly matching 100, so this will be something like 100% cross reactivity. If somebody who is, you can say like matching a little bit, then at that time the lesser cross reactivity which will happen like this. So the modalities of exposure to pet allergen, how a person can get exposed to pet allergen. One, the the important crux of this slide is basically that if a person who gives a history of pet exposure within previous 3 years, then at that time he might get sensitized. He might get, you can say, it is considered to be exposed. So previous ownership, even if the pets have been removed or deceased at around 2 years or before, if the direct domestic contact, the patient with the pets at home, because pet ownership for at least 3 years is there, then direct contact elsewhere. The patient is not having, you can say, like pets at home, but he is getting close contact with pets outside the home for at least 3 years, that home or others. Then there is, you can say like indirect contact. Indirect contact means in the sense, like for an example, if a child who is coming to you, you are, you can say like unable to get the clue that to which thing this particular child might be sensitized to, and then you tested something, cat came positive, or the pet animal came positive, and then you acquired the history in deep, and you came to know that the other child, the colleague of the child, or the friend of the child, the school friend of the child, is having cat at home, and that particular cat dander, which is getting carried on the second child's cloth and getting passively transferred to the first child clothes, and hence the first child is getting sensitized and getting symptoms. This is also possible. And sometimes, even if by deep digging history, there is no apparent contact history, which you come to know, and the patient is actually unable to trace the contact, because many times, like for an example, cat. So cat allergen is considered to be, you can say like a heavy allergen, large allergen, and this cat allergen is very sticky allergen. If a cat is passing over the carpet, or it is, you can say, like getting touched by the curtains, then the cat allergen which is getting deposited there, it can stay there for 6 months. So it is possible that a cat might have moved from there 3 or 4 months back, and the person is not aware about that. And when he got there, then at that time the symptoms started. So this is possible that no apparent contact is there. So dog and cat allergies, what are the different symptoms they can cause? So apart from respiratory allergies like rhinitis or asthma, they can actually cause other symptoms also like conjunctivitis, obviously rhinitis and asthma, and then skin manifestations. These skin manifestations could be urticaria, could be dermatitis, atopic dermatitis, could be angioedema also. So all can be done. So the consensus document on dog and cat allergy, which was released somewhere around 5-6 years back, suggests that the characteristic of dog and cat allergens, which we have already discussed in detail. So these are the molecular masses and the sensitization pattern. So the sensitization pattern, you can just see that in cat allergen, it is very high, nearly 100%, 96 to 100%, but none of the dog allergen is actually matching near to that. So definitely it is, you can say like cat is highly allergenic. And markers of clinical symptoms are that the markers of severe asthma. If you just want to see that which particular child is going to have severe asthma, along with these allergens, high levels of specific IgE to either cat or dog or horse, polysensitization to all three animals. So you can actually predict that, okay, this particular child is likely to stay asthma, his asthma is likely to stay for longer time, and he is likely to be having severe asthma. Sensitization to CANF2, if you have a, you can say like a facility in which you can actually do the component testing, then if you are getting CANF2 sensitization, then yes, there are chances that this is, you can say, like a better allergen if there is no CANF2 sensitization is there. If sensitization to CANF2 is there, then there are more chances of higher severity. Sensitization to CANF5, this is also considered to be more severe asthma association. And polysensitization to 3 or more lipocalins, which is also an important factor for marker of clinical symptoms. And then CANF1 has been associated with persistent rhinitis, CANF2 with asthma, CANF3 with moderate rhinitis and asthma, CANF4 with persistent rhinitis, 5 with persistent rhinitis, FeLD2 is with moderate rhinitis and asthma, FeLD4 is a diagnosis of asthma. So what I'm saying is that there is now a time of components in which more detailed knowledge about the component can actually be helpful, that okay, this particular child is likely to stay with his allergies or with his asthma, it is very less likely to outgrow, or this particular child is more predisposed towards severe asthma, or you can actually get a predictive ability with this component. So you can actually ask different questions, in which the main important question is revolving around those 5 areas: direct exposure elsewhere, previous ownership, indirect exposure, and no apparent contact. And then you can actually ask that, okay, for how long the exposure was there, and whether in past 3 years or so the exposure was there or not. Here there is an interesting line in which they are saying that are these pets home because of ownership or frequent permission to enter indoor during pregnancy or first year of life? Because it has been considered that during early years of life, during first year of life typically, or during pregnancy, if there is an exposure to dog or cat, then at that time they might be preventing allergies. Whereas if the exposure to dog or cat is from second year onward, then they are more predisposing towards allergies or asthma, which is important. So whenever a patient is coming to us with a possible allergic history, then at that time, as per the detailed clinical history, we have to perform with the skin prick test, specific IgE, and then if we are okay matching with the history, then we make the diagnosis. If we are still not certain, then at that time, even the component testing and the cross-reactivity can be helpful to us. Now the question is that I have spoken almost nearly 25 minutes about the pet's allergies. So the question is that, are pets so allergic? Is there any benefit of pets or not? So yes, pet keeping is an early life, reduces the risk of allergy in a dose-dependent fashion. I just mentioned you that if somebody who is keeping pets in the early life, especially during pregnancy or in the first 1 year of life, then at that time they can reduce the allergies also. So this is one chart which is saying that pets at 6 months of age and allergy and sensitization, they can actually reduce your bronchial hyperresponsiveness, your all other, you can say like testing like total IgE, skin prick test to all other allergens in the subsequent follow-up, they can also be lesser. About the childhood eczema and household pets, so the literature review is actually mixed. So there are certain studies which says that there is a positive correlation with, you can say like, pet exposure and the severity of eczema and the onset of eczema. But there are equal number of papers which are not finding any significant association or the correlation between the two. So what can we do? What can we advise? The simple advice is that you can just remove the pets from the home. Is it so simple? It's practically probably not that simple. So, so this article says that you can keep the cat but change the care pathway of the cat, which is a transformational approach to managing FeLD1, the major cat allergen. What they are advising is that this is the practical solution which they are giving to the patient, because many a times you ask them to remove the cat or remove the dog. Many a times they change the doctor rather than removing the cat or the dog. So the practical advices could be, though they are not that effective, but still they are practical, that the excluding the cat from the bedroom, keeping the cat outdoors, using HEPA filters with vacuum cleaners, so which is important. So whenever you are prescribing vacuum cleaner, you always prescribe with HEPA filter. Removal of carpets periodically, using pillows and mattress covers, removal of or covering of upholstered furniture, weekly vacuuming or steam cleaning, which is important, wet mopping floors and surfaces, washing walls, ventilation to increase air change rate per hour, changing clothes before moving from an area of high allergen levels to one with a lower allergen level, using nighttime laminar airflow ventilation, and regular bathing of cats in the home. Now, bathing of cat is actually not that practical because cats hate water bathing. So it actually becomes difficult, really a nightmare to bathe the cat. But yes, these are the methods which have been advised if somebody who is just very adamant and they cannot remove the dog. Then there are certain other interventions which have been advised. So one is cat level intervention. In the cat level intervention, what you can do, I have just discussed, remove the cat, or now the people have come up with a new molecule which is called as something like a egg-based molecule, egg yolk-based molecule, which is actually having anti-FeLD1 Ig antibodies. So what it does is that you are actually, it is basically a colorless, odorless chemical which is based upon egg yolk. So which is anti-FeLD1 Ig antibodies. And this chemical is mixed in the cat food. And then you can feed the cat with this particular chemical. When this chemical is, when this food is going in the mouth of the cat, then at that time the saliva is produced. And the saliva is containing FeLD1. And this chemical is actually having anti-FeLD1 Ig molecules. So they get combined to each other, and ultimately a larger size molecule is produced which doesn't remain airborne. So ultimately the allergenicity is reduced. So this has been seen with some success, and the people are marketing this formula which is available in the United States. And then environment level interventions, you can bathe the cat regularly if you can. Modified home environment, I just mentioned you, and clean home environment with some vacuum cleaning, sunlight, ventilation, and then patient level interventions. So you have to give with pharmacotherapy and allergen immunotherapy. So allergen immunotherapy work wonders in cat allergies. Then hypoallergenic pet, I just mentioned you that there is no hypoallergenic pet which is there. Air purifier, vacuum cleaners, I just mentioned you that yes, they are helpful, but at least with the HEPA filter. And bed encasings and membrane barriers, they should be used, they can be prescribed, but the pore size need to be less than 6 micron, then only they can be helpful, otherwise no. There are certain unmet needs and challenges in which the well-characterized allergen extracts, we actually need some component testing refinement. And can we do some skin prick component testing also? Then measurement of exposure to individual proteins in homes with or without animals, as well as public location. Like for example, somebody who's not keeping pets but still getting sensitized to pets, especially in the public location. So is it a good means like how good or how bad it is? So we should measure that. Assessment of stability of allergens, we need to see, and then identifying reliable clinical and molecular markers like component result diagnostic. So these are the last few slides just for another aspect. We always make a hue and cry that, okay, we are allergic to pets, or the children are getting more allergies to, you can say, like cats and dogs. But the story can be other way around also. We humans are allergic to numerous environmental agents, but it is possible that even the cat and dogs, they by themselves get allergies to human. It is possible. So do other animals get allergies? Yes. So there are certain reports which are there. Could my cat be allergic to me? Yes. Cats and dogs and horses can all develop allergies in much the same way against humans, as well as to other aeroallergens also, or even to food allergens also. So allergies seems to be much more common in the domestic pets than in the wild animals, because they are in the home conditions. And if they are in their own native conditions, then the allergies are less. So meet the dog that's allergic to humans. Animals can suffer from asthma. And then this is one polar bear which I saw in Colorado Zoo. so who is actually allergic to human dander, and ultimately he is receiving daily doses or injections of diphenhydramine because he has to stay in the zoo and humans are there. So he is actually getting exposed, and ultimately he is basically drugged daily just to, you can say, like poor polar bear. So the dog who is allergic to humans, unlucky dog. So who is allergic to humans? So there are various papers, and then this paper is suggesting that dogs and cats can also develop some food allergies, particularly to beef, dairy, wheat, lamb, chicken. So all these things can happen. So this is the last slide in which how these allergies are developing to the pets, or the pets are getting allergies to humans. It's based upon the genetic factor, which we call as atopy, and then lot of environmental factors, how the child is born by the cesarean section, is a single child or more than one child, joint family, nuclear family, single family, use of antiseptics, excessive cleanliness, antibiotics in the early life. So all these are predisposing towards allergies, whereas pets in the early life, increasing family size, rural environment, they are reducing the allergies. And then diet also. So diet is actually modifying your microbiota, and microbiota is now the, you can say, like the talk of the future. So junk foods, baby foods, increasing the allergies. Homemade foods, high fiber foods, decreasing allergies. Breastfeeding, very good, reduces allergies. Probiotics, probably good, reducing allergies. And then ultimately, these all will decide that whether this particular person will develop towards allergies or this particular person will towards non-allergic condition. So our aim as an allergist is that we want to actually get a good bonding, not only among humans, among all the different species, among all the creatures which are there, which all are created by the God. So the basic, I will say, the mantra is Vasudhaiv Kutumbakam. With this, I would like to stop here, and I would like to once again thank Dr. Shambhu for the opportunity. Dr. Shambhu.
Thank you very much, sir. And I think we are really benefited with your lecture. And I think to just a short summary, what we learned from Dr. Gupta, he had highlighted the complex interplay between pet allergens, particularly the dogs and cats, and their impact on the key allergic conditions like asthma, rhinitis, atopic dermatitis. For pet owners, what should be the take-home message? Even short-haired or hypoallergenic breeds, though that is a very common term used by the business people, but it is not actually true hypoallergenic. They also can trigger allergies. So proper ventilation, pet hygiene, and limiting the indoor exposure, these are critical for sensitized individuals. For practicing allergologist, to reach the accurate diagnosis, we need a combination of clinical history, skin prick testing, sometimes specific IG testing, and also very important, the awareness of cross-reactive allergens. Like Dr. Gupta had beautifully elaborated certain serum albumin, lipocalins, and while treating, allergen immunotherapy is really promising, especially for cat allergens, though the evidence is evolving. And most importantly, to ease, that is education and environmental control. These are the primary tools. So while most of us associate allergic disease with dogs and cats, avian allergens from pigeons, parrots, and other birds, especially in urban and semi-urban India, are also significant, though often under-recognized. To help us understand this, I would like to invite now Dr. Anil Sachdev. Sir is a very senior expert in pediatric pulmonology, intensive care. So, sir will reflect us on this wider environmental spectrum of allergen exposure. So, sir, we often focus on cats and dogs when we talk about pet-related allergies. But if we look around Indian homes, especially in dense urban or peri-urban neighborhoods, there is another silent presence, that is birds. From pigeons to parrots, sometimes we have lovebirds and even some moinas. They are kept in small indoor cages. So they are part of the air we breathe, And children in particular spend hours around them, often unknowingly they inhale the microscopic particles of feather, droppings, and cage dust. So while dust mites and pet dander are well established culprits, how do you see the role of bird exposure, particularly from pigeons and parrots, in contributing to chronic allergic respiratory illness or sometimes hypersensitivity pneumonitis? Sir, please give your clinical experience. How often do these feathered allergens or triggers fly under the radar when evaluating chronic respiratory issues in children? Sir, please.
Okay. Good evening, everyone. Thank you, Dr. Neeraj and Dr. Shambhu, for giving me the opportunity. Uh, Let me make it very clear at the outset that I don't practice allergy like Dr. Neeraj is doing. So if I have a case purely allergy related, I refer to him. So because of the details, whatever he has told us in the last 40 minutes or so, it was mind-boggling, and so much of research has gone into this aspect of, allergy to animals. Yes, whenever we are facing a child with a chronic cough, and in the clinic or in the office, and we have to go into the details of the history of the environment in which the child is living. And in such a situation, the parents will never understand why the pigeons are important for this. What is the correlation between the pigeon or a dog or a cat with the disease of the child? They almost always correlate it with the some food item in their house, and that is the common practice, at least in the northern India. Everything is related with the cold water or cold ice cream or something. So that is how it is. But yes, we have to go into the detail of the history, and we have to ask leading questions about the environment of the child, whether there are pigeons, whether there are parrots in the house, or dogs or cats, or some other pets in the house. Pigeons are usually not in northern India, especially in the Hindu families. Pigeons are not very commonly kept as a pets. But for the Muslim families, whenever they come, I always ask them because they are very fond of keeping pigeons. So they always, many of them, almost 40-50% of them will say that, yes, we have pigeons in the house. The other common thing which I have experienced, particularly with the pigeons, is the shafts in the multi-story buildings. Now, all these shafts in the multi-story buildings, there are lots of nests of the pigeons, and that acts as a source for allergy or for the hypersensitivity pneumonitis. Uh, Now, when a child or a patient gets exposure to pigeon, or the pigeon particularly, the shedding or the feather, now it is your body's reaction whether it will go towards the allergy side or will go towards the infection side. So if it goes to allergy side, the patient will go to Dr. Neeraj. If it goes to infection side, patient will come to me. So that is how it is. So the pigeons, as far as my experience with pigeon hypersensitivity, hypersensitivity pneumonitis, yes, few cases we have diagnosed with the use of tests available in our hospital. My exposure or my experience with the lentil hypersensitivity is there. We have almost now 20-25 cases of lentil hypersensitivity, and all these kids are infants after weaning. The the mean age is around 10 to 12 months of age, and they all come with the 100% of the all patients. They came with the chronic cough, non-responding to any treatment, nebulizations, antibiotics. Few also received, few months of antitubercular treatment, and neither the symptoms resolved and nor the X-ray showed any improvement. So we published a series of 9 cases last year in Journal of Pediatric Critical Respirology and Critical Care, and uh, and some of the patients, like almost 70% of the patients, had fever, continuous, like they were investigated on the lines of PUO, and 100% had infection, the cough, and 2, 3 patients required oxygen or high flow nasal cannula, and even ICU admission in one patient because of hypersensitive pneumonitis, lentil induced. So that is my exposure. Then uh, diagnosis is again, when the child comes to you with chronic cough and he's not responded, and you go into the treatment history and details of the treatment history, you understand that the child has not responded to any treatment. And the X-ray and the CT scan, they are particularly very peculiar in these patients. The X-ray is usually what you see as a paramediastinal, parahilar, paracardiac densities, consolidations. The peripheries are usually spared and they're very dense, and you can see that as if something has gone into the airway and caused the aspiration pneumonia. But there is no history of the parents will never give you history of choking. But yes, if you go into the detail, there will be always a history of force feeding in these kids. In our series of 9 cases, and after that we have diagnosed many, there was always a history of force feedings. So that is, and lentil being our staple food, that is, the first winning food that we start. And the child does not develop a taste for it, and whatever reasons are there, and there is always a history of force feeding. So chronic cough, fever plus minus, not responding to antibiotics, or you are at bronchodilator therapy, parahilar, paracardiac densities in the X-ray or in the CT scan, and force feeding. So this is the combination of these factors should make you highly suspicious of lentil hypersensitivity pneumonitis. And in the CT scan, again, you can see central lobular nodules are there. Then the consolidation, the alveolar shadows are there. So these are the things we have experienced, and we published a case. I just want to mention one very latest case. 1.5 month back, this child came from Bihar with history of nebulization, repeated 3 hospitalization for persistent pneumonia. And when I saw the X-ray, I got the CT scan done. I did the bronchoscopy. CT scan again, it was for me now it's a spot diagnosis that it is a lentil hypersensitivity, looking at the age and the other factors. So I again asked them about the force feeding. They said yes, force feeding is there. And the child is very lean and not marasmic, but is a lean child, infant. And I did bronchoscopy, all workup negative, including tuberculosis, everything negative. We sent lentil IgG. When we check for IgG, we don't check for IgE in hypersensitivity, but the pathway is different. Okay, so this is type 3 and type 4 type of sensitivity. So we check for IgG, and it was reported as negative according to our lab reference values. So, okay, the child was all right, no distress, no fever, cough was reduced, just with symptomatic treatment. I told the parents that you come after a month and then we'll review. Don't worry. If there's something happens, you come quickly. So they understood. I did not start ATT. At one time, I also had that, inclination of starting ATT and given trial of 6 weeks and see what happens. I said, okay, the child has everything negative, so I'll just hold on. Now that last 10 days back, this child came. I did chest X-ray, same X-ray, no change, though child does not have distress. I did CT scan, again, absolutely mirror image of the previous CT scan. I again sent the hypersensitivity panel, and this time it was more than 100. This time it was positive. So you have to stick to your thoughts, and you have to be very scientific in your approach, that the factors are there, but why the test is not coming positive. So I have started this child on oral steroid. The treatment is removal of the offending agent for any hypersensitivity pneumonitis. There is a huge list of factors which can cause hypersensitivity pneumonitis, like birds and pigeons and lentil, and then some fungi and all. There is a huge list. So you have to remove the offending agent. So, and you start on steroids. We have treated our kids with uh, uh, with oral prednisolone, 1 milligram per kg in two divided doses for first 2-3 weeks, and then taper it over next 5-6 weeks. The total course is around 8 weeks, and almost 80% of the kids responded. Only two kids, or one or two kids, they had to, whenever we were tapering these steroids, they had a relapse of the symptoms, so we had to give prolonged. But nothing more than that we have done for these kids. And this child I'll see in after a month, and I'll see, what is the improvement. So this is my experience about the lentil hypersensitivity pneumonitis and pigeon pneumonitis.
Thank you, sir. Sir, can you please little bit elaborate more on that hypersensitivity panel, the laboratory investigation that we should offer to our patient?
So in our hospital, we have a panel of about 12 agents, and that includes pigeon, that includes lentil, and that has a few fungi, and that is though you can mix and match according to your need. So the company will give you, it's a basically immunocap type top system. That is what we are using in our hospital. And we always ask for the IgG. We are not asking for IgE. IG is a different pathway. This is IgG. So that is
Yeah.
what we are.
Thank you, sir. Sir, I think there is another test which is in experimental mode, and generally we also do it for drug allergy evaluation, the lymphocyte transformation test, or LTT. But it is not available in, I think, in India as a commercial purpose. But that also can identify the type 3 and type 4 hypersensitivity reaction. So, and what about the different precipitin test? What is your take on that?
Precipitin test we have not done. This is basically what we are doing is a immunocap type of ELISA type of test. And precipitin test, I think, if I remember correctly, the sensitivity and specificity is not pretty good.
Right,
Yeah.
sir. So thank you very much, sir. So may I also ask Dr. Niraj Gupta, sir, so how often you see the type 1 hypersensitivity with this type of birds?
So, regarding the birds, actually, we are not testing so much for type 1 hypersensitivity. We do not have specific IgE for, you can say, like for these birds. And simultaneously, we do not have even the skin prick test solutions for these birds. So, majority of the time, we are testing for the cat and the dog. And this particular child, which I was mentioning, actually, mother asked me a particular question. Okay, can my child be allergic to horse? Then means like surprisingly, I was very surprised at how she is asking that the child can be allergic to horse. I asked a counter question: do you have a horse at home? Because who means like keep horse as a pet? So then she told me, no, no, we don't have a horse at home, but the child is having horse riding classes in the school, and we have seen that whenever the child is having these horse riding sessions, then at that time the symptoms are more. Then I tested with the immunocap technique as well as the skin prick test for horse, which is available, and it came positive, and rest of the other things were negative. So this was matching. But for birds, we are not having the specific IG, at least in our hospital, but you can definitely order them, and these are there. As sir rightly mentioned, that these are type 3, type 4 reactions. So that is why specific IG is not the right choice. It has to be specific IgG based technique, which is very important.
Thank you, sir. So I think sir has explained a very classic case where we also had an historical terminology, the bird fancier's lung, or that is the hypersensitivity pneumonitis. And today only I was going through one Egyptian study which had found that sweeping bird cages in closed environments led to faster onset and worse lung function, especially in non-smoking female and children. So again, that is quite interesting, and I think the same mechanism which we are discussing may be contributing to that fact. So what is your take on that, sir, Anil sir?
On these birds.
Yes.
Yeah. Yeah, definitely the exposure is there. So I can recall one girl. This is again adolescent girl came to me with the persistent cough, and they had a few X-rays. They had bunch of investigations done, but nothing was coming positive. Then again, as Neeraj always says, go into the history, go into the history, go into the history. So we got go into the history, and then as like a old timer, घर में cigarette कौन पीता है, घर में dog कहाँ है, carpet कहाँ है, ये सब. So you ask everything, and there's nothing positive. And then we got the CT scan. The CT scan was suggestive of interstitial pneumonitis, pneumonia, suggestive of hypersensitivity. We got the panel done, and it was positive for pigeons. Then we asked, where are the pigeons in the house? Then the father recalled there are lots of pigeons in the shaft. So this child was started on steroids. The shaft was blocked, whatever he did. But he said, I have taken care of all the pigeons. So this girl improved, and she is asymptomatic now. So the exposure is the main thing.
Yeah, thank you, sir. So, to have a take-home message from what we learned from Dr. Sachdeva, while canine and feline dander are commonly recognized allergens, avian antigens from pigeons, parrots, lovebirds, and similar birds are an underappreciated trigger of chronic respiratory disorders, inflammatory disorders, especially in urban and semi-urban settings. And children frequently interact with birds, especially in confined apartment spaces, and that would increase their risk of developing hypersensitivity pneumonitis, which is also known as bird fancier's lung. So there is important clinical relevance in pediatric population, also adult population. Bird exposure is often overlooked in respiratory evaluation. Chronic exposure to avian proteins from feather, droppings, and cage dust itself can trigger this hypersensitivity pneumonitis, which is an immunologically mediated interstitial lung disease. It is distinct from asthma and simple allergic rhinitis, which are mostly type 1 hypersensitivity reaction. This is mostly type 3 and type 4 hypersensitivity reaction. The clinical manifestation already we had discussed. Dr. Sachdeva had taught us the different manifestations, like starting from chronic dry cough to low-grade fever, to failure to thrive or poor weight gain, breathlessness on exertion. And the history is, when we talk about bird exposure, lived in a household with indoor caged parrots or certain other pigeons like that. So history of close bird contact, and in auscultation, it could be just like any ILT finding like inspiratory crackles. HRCT can show the centrilobular nodules and ground glass opacities. Lung function can show the restrictive pattern. And sir had tell us about the hypersensitivity panel testing, focusing the specific IgG, and the treatment should be the conservative management, as sir has mentioned about the role of steroids. But removal of bird exposure is extremely important, which lead to symptomatic improvement. And there are very important ways by which we can prevent this type of exposures. So I think this is quite a learning experience for all of us. We had learned a lot from these two great teacher. So I request Dr. Neeraj Gupta and Dr. Anil Sachdev to have your final comments for our delegates.
Sir, first. Sir.
Yeah. So my final comment is don't lose the basics. Always stay at the basics of medical science. Always take a good history. And as we always understand, we have been taught through our years, that clinical history will give you a diagnosis or a clue to the etiology in majority of the cases. But yes, if you're in a busy clinic, you may ask the patient to come on some other time, when you have time, and go into the details, and then plan your investigations, plan your investigations according to what you are getting in the clinical history. And it's not always easy to hit at the diagnosis on the first visit. So you have to gain the confidence of the parents that, you are working on it, you are thinking about it. And I think one will be successful in reaching at a diagnosis.
So thank you very much, sir. I think sir has already spoken everything, and there is nothing else extra which I needed to or I want to add on. History is really, really very important, and at least in our subject with this allergy, 90% of the thing, 95% of the thing, it is there lying in the history. So thank you very much, sir, for giving such beautiful messages, encouraging messages to us, and attending this webinar for your with your insights. And thank you, Dr. Shambhu, for moderating this. Wonderful moderation today on this very important topic about understanding pet allergies. And I would like to now conclude here with thanking all the participants who have attended today. Thank you. Thank you very much and good night. Thank you.
Thank you. Thank you very much.
Thank you.
Thank you. Thank you, Shambhu. Thank